We come from a core belief of treating every child as if they were our own. There is nothing more sacred than when a family turns their child over to a healthcare professional. We take that trust extremely seriously. This hospital will represent how the Nemours Foundation believes care ought to be given to children in the 21st century.
When you're taking care of a child, you're taking care of the whole family. It's not just one or the other, it's both. It goes back to our very origins with the Alfred I. DuPont Institute that was established in 1940. Their children had to stay for weeks, months, years at a time, and so we had to create a place in which they could be children. That has been woven into our DNA, such that today we really seek to address the needs of the whole child and the family as we attempt to solve the immediate problems related to their health.
Tatum was a very healthy child. She never had had any medical issues. One day we went to SeaWorld for a day of fun, and I noticed towards the end of the day that she had these huge bruises all over her legs. The pediatrician told me that it could be a bacterial infection or it could be my worst nightmare. And she whispered, leukemia. When you're looking for someone to heal your child, you want the very best.
We're trying to understand what a family really needs and then deliver that when these doors open.
We want these families to be present every minute of every day if they want to be.
If you're there a day or two, it doesn't matter, but when you almost becomes your second home for a while, it's important to be comfortable and be there with your child.
We engaged from the very beginning a family user group, and they had a significant input in how we designed the building and how we could best meet their needs.
You know, it's like a breath of fresh air. You think something so easy, asking people for their input and how they might do something. I haven't experienced it before.
They asked us about every detail of the hospital.
Well, nobody wants to think of a hospital as a resort or a hotel or a place to stay, but it sure is nice that when you're there, that there is room for you to sit on a couch next to your wife, or to be able to, in the evening, pull the couch out and get a decent night's sleep and have internet access or other things that get your mind away from what's actually going on.
They took a group of nurses who have had experience of working in an ICU, and we went over to view and to get a feel of what the room would look like. Was the equipment in the right place? Was the room big enough to accommodate a family member with a bed and the child's bed? Where would the nurse's cart go? Where would the TV go? Was the bathroom accommodating for children?
These rooms are designed to accommodate x-rays, other large equipment to come to the child, as opposed to transporting that child to various areas in the hospital.
I think the innovation for the project is really starts with a model of care and the architecture that supports it. Building that environment that is both patient, family-centered, and also supports the staff and the clinicians that are giving the care.
You have your clinical setting on one end and then the hospital setting on the other end. If they come to the clinic and if they have to be hospitalized, all they have to do is go across the corridor and they're in the hospital side. The disciplines are right there. Radiology is right there. The parents don't have to get in their cars, take their sick children and go to another doctor in another department.
And the beauty of that is that the care providers, nurses, respiratory therapists, child life specialists, whoever they are, would always be the same care providers.
As simple as that sounds, and as illogical as that sounds, that is not true in hospitals today, with rare exception.
One of the things that we've really incorporated into the design of the hospital is almost bringing the outdoors into the hospital.
Instead of, taking a small little garden and putting it in the midst of a big hospital, we're taking the hospital and putting that within the garden. All of our waiting rooms have views to nature, and that's really key. We all like to be in daylight and sunlight and know what's happening outside. If we can provide that, the research proves that it's going to help. It's going to help the patient get better quicker. As soon as you arrive on campus, you're driving through a garden setting. You can go right into emergency and park and access the emergency department and its waiting room. Entering the main lobby, there's a fountain outside that is reverberating water sounds, calming the patients and visitors. Our main cafeteria is directly adjacent to it, and it has an outdoor terrace. As soon as I get off the elevator, the lobbies open up and there are views. The second floor is where our outpatient surgery department is, and also the surgical clinics.
The third floor is the intensive care unit, both the neonatal intensive care unit and the pediatric intensive care unit. Or on the fourth floor, there is the infusion center that many of the specialists will use. And then on the fifth floor, there is an ortho-neuro rehab unit with a rehab center. It too overlooks the garden, just as everything else in that hospital overlooks the garden.
One of the things we're doing in our inpatient rooms is lighting the room with color.
At night, you'll see different rooms with different lights. It could be green or pink or blue or purple.
Giving the child the chance to control both the lighting in the room, the shades, so they can control if it's too sunny outside, let's make it a little bit darker so they can take a nap in the afternoon. Not make it like home, but give them as much control back as if they were at home, so that they can really feel like this is my room.
Nemours has leveraged our ability to use technology in ways I've never seen before. We have a fully leveraged electronic medical record. We're one of the very few, I think less than 5% of hospitals in the country are at this level.
When a physician or nurse needs to look up and see what's gone on with the test that the child's received, they've got it right there on the computer, and oftentimes it's right at the bedside. All of the information about the treatment of this child is resident in one location, so the physician or nurse can easily look back and see what previous treatments have been made, and then make sure that the way the course of treatment is continuing makes sense with that treatment process.
Having the Nemours Children's Hospital here in Central Florida is probably going to be one of the biggest things that happened to Central Florida in a very long time.
The hospital itself is located within what has become known as Medical City. The beauty of this is it enables us all to benefit from, number one, the fact that we're all starting new, we're all building new cultures, but secondly, that we've got the opportunity to collaborate with each other and really build on each other's strengths.
Being able to have Nemours, VA, Burnham, University of Florida, all of the partners out there in one spot just makes the whole thing that much more powerful as a magnet for our biomedical science and biomedically related businesses.
And there's nothing more important, I believe, in our lives than the health of our children. With Nemours being there, it will be a resource that can be counted on for decades to come.
It is a huge opportunity, an even greater responsibility, and quite a privilege to be part of that group that will, in the end, serve this region and, more importantly, serve the residents of Florida to a degree that I don't think the state has ever seen before.
This was Tatum the day after she was diagnosed in the hospital. And as you can see, she loves accessories. She went through a phase where she would only be dressed up like Dorothy and wear ruby red slippers. And so that was after she lost her hair. And this is her, this was taken 2 weeks ago, her and her little dog, Cassie.
A freestanding children's hospital is a totally different entity than any hospital that we have in the Central Florida area. With Nemours, pediatrics is the core competency. Taking care of children is all we do.
We view our role in helping children as a sacred trust or promise in helping families in rearing their children to achieve optimal development. In the past, we focused on healthcare, but as we've matured and grown in abilities, we are now looking at how we can impact the whole child. We do that through our healthcare operation. We've expanded 6 years ago to create a prevention and wellness operation. We have now delved into reading readiness and child development. We believe that we cannot provide the best care without being deeply involved in research and education. We are pursuing the next generation of educating healthcare professionals, and we are advocates for healthcare policy and for the interests of children at the local, state, and federal level. And through all of those activities, we quite simply are attempting to help children grow up healthy.
They're creating a legacy. It's more than just a building or a structure. That's going to affect the lives of everybody who walks through those doors. Well, I don't think of it as a hospital. I think of it as a place of hope and healing.